Here we are. We are live now with Dr. Chris. My name is Joseph Lucier, and I have the great opportunity to introduce you all to someone who's brought wheatgrass to the next level of healing. He's from Australia, and he's going to give you his story. I'm going to let you tell you in his own words, but I know from my personal experience with my own healing practice, I've used these wheatgrass products with different people with amazing results. So with that said, I'd like to introduce Dr. Chris from Australia.
It's a great pleasure to be here. It's an honor to be here. I was in general practice. I don't know, do you call it general practice in America? Same thing. Yeah. I was a GP for a number of years. But I sort of always got that feeling that I wasn't, because I always dreamed I would be able to heal things. If you study in medicine, you'll come out healing. But I wasn't. I found that there was many areas in medicine, like wound healing and infections and things like that, burns and all sorts of other conditions. There was really nothing available that actually, for instance, in burns, stopped the patient's pain or prevented infection. All right. This is Molluscum. I think we all know what that is. If we've had kids, we certainly would know what it is. It happened to me, actually, because one of my kids got Molluscum. He was about 4, I suppose, just spotted them, and I said, well, I better put some of this grass on because it's not going to work. But I was trying it on everything.
Hi, great.
And he was covered. It was much worse than this, actually. And then I forgot about it. And a couple of days later, I said, let's have a look at those spots, Michael. And I couldn't find them. and I said to my wife, she was a nurse, and I said, I don't believe this. It's just gone. I mean, there's nothing out there that works for Molluscum. Well, there are things out there, but which I never actually tried because I had reports from patients that it didn't do anything. Molluscum it's a condition that a GP sees and says, well, you're right, you got Molluscum. And that's about as far as you can go. I know there are a lot of medications or herbal remedies out there for Molluscum. I think a lot of them work. But this is just to show you that what we've got here is an antiviral response. And so it looks like the grass has triggered that response. This is a classic example of how rapidly the grass can work. I've met this man. His wife was a nurse, and she from West Australia, and she rang me up and said, and she told me about her husband. And I said, well, she says, is the grass going to help? And I said, yeah, of course it will. So she did. She put it on, or he put it on. He went down to Perth because they were living up in the bush in north of Perth, and that's what happened. He was a farmer. And he was a very tough farmer. And she said she didn't know anyone so tough as him, but he was crying with the pain. You can see here, well, the first picture you can see there, 3 days after. What we've got here, just in just over 2 weeks, I mean, you wouldn't know he's had radiation treatment there. How has that happened? Well, how it's happened as far as I'm concerned is that the grass, again, has signaled this process or this problem up to here. It's reconnected. We want to have to ask oneself first, he was having a cancer removed from his axilla. How did that cancer arrive in the first place? I think what happens is that the brain sort of controls everything, and that connection between the brain and all the other parts of our body, those connections are extremely important. Mm-hmm. And if they go awry, then things start to happen on the skin or in the gut or in the heart or in the lungs or whatever. And much of the way that wheatgrass works, I think, is it reconstructs or realigns that connection by the ligands that exist in there by pain reduction with substance P as one ligand. It blocks the passage of pain. It stops it from getting to the brain. But the brain is forever connecting with the periphery. That's what it does. It's controlling everything, but it's doing it all in one hit. It's a pretty clever organ up there. When you think about it, and it's 24 hours a day. They don't get smokers or anything like that. They just keep working. And I think that there's a lot of what we call autoimmune conditions
Uh-huh.
due to this breakdown, this connection with the periphery, like in psoriasis. This man, he's from India. This gentleman had, as you can see in the left there, the thick plaque. That's very thick plaque. And he's had this problem for probably 5 or 10 years. As you can see, after 2 applications of the wheatgrass, and this was over about a month, you can see how the plaque all up here and down here is thinned out, and you can actually start to see new skin underneath. It's like it's being peeled off. That's not the wheatgrass is doing that. That's the brain doing that. I'm sure of that.
Okay.
Because I'm talking about many thousands of patients with many, many different conditions. And there's always this sort of pattern that I've started to see happening over those years. And after a while, you can be fairly confident, not cocky, but fairly confident with your patient and say, yes, I think we can do something about that. That's a horse. This is from an American lady in Mexico who runs a horse hospital, but for stray horses. She loves our stuff because of this. I mean, this sort of thing. And I've got all sorts of cases from her. But we got from at 7 weeks, you've got this massive wound. The horse bumped against the wire fence, ripped its skin off. But in 7 weeks, you've got not only a much smaller wound, but look at the tissue around here. The fur has returned, right? Normally you get scarring from this sort of thing. And if you go right down here at 18 weeks, the thing's completely healed. And if you look around at the fur, but it's come back, and all you've got down there now is a scar, a small scar. She told me herself, she said, this just doesn't happen. And I said, well, I was expecting you to say that. In the animal world, it could make a significant difference to the healing process. To me, it's a game changer. After 27 years working with it and trying it, and as I say, it's something you can drink, so I never have any concerns about prescribing it.
The one of the testimonials that I actually distributed around was a video of the stroke victim who ended up driving his car within a short amount of time. And there's quite a few videos and quite a few testimonials, but I think everybody needs to understand you've certainly adopted a healing model as opposed to a business model. You want to just be helpful to people, and that's also one of the things that I wanted to mention for the people that are listening right now, that you spend a lot of time free to help people all over the world, especially in your part of the world. And that also really touched me as well. So I wanted to mention that and give you thanks to that because you just want to be helpful. And that shows up very much in all of the work that you've done. And I think people should understand that. You're doing it, you're proving it, and you got even all of these cases to show. And I think you're coming from the right space, which is also inspiring to me and hopefully to everybody out there, that you're coming from a space that you just want to help people. And there's nothing better than that, nothing more powerful and profound than that you found something amazing. You said, well, I just want to change the world and help everybody. And that's why I think that you're so inspiring to me and many others. But with that said, I'd like to say thank you very much for joining this interview, for enlightening us about the profound effects. And is there anything else that you'd like to say to everyone as we wrap up our very exciting opportunity? Thank you very much. I benefit more than I think just about anybody out there. So thank you very much. And what would you like to say to everybody out there listening to you today?
Well, first I'd like to thank you for being so very nice and friendly and interested. It makes a pleasant change for me to find people that are interested about it. I think what you're doing, I think there's a bit of a connection there. We like helping others.
Yes.
And you love seeing it get better, and it's sort of I don't know. I think it'd be nice if we all did that to each other. It'd be friendlier place. We'd stop throwing bombs at each other.
Yeah, I think that's a great message. I mean, if our perspective is, I want you to feel better, I want to reduce suffering, that certainly would change the world.